starting earlier. Women are accustomed to seeing a doctor, getting regular checkups since they were young, right? Since they got their period, accustomed to doing it. Men, nope. Like, we just kind of float through life, and that is why we don't know what our blood pressure looks like. We don't even know how to talk about our mood. We don't even know how to talk about when we're stressed, when we're angry, when we're anxious. We don't even know how to talk about these things because we're just walking around through life like everything is cool. All right, so today we're going to talk about just why men are dying a lot younger than women, right? And on average, depending on where you read, 5 years, 6 years seems to be the give or take rate on how much younger we are dying than women. And we're going to talk about why. And a lot of it, right? A lot of it is system bait, it sounds weird, right? A lot of it is, yes, there's some choices. There's definitely some choices around what we're doing in regards to why we're passing away earlier, right? Whether it be due to cardiovascular disease, suicide, there's some reasons why. But we're going to also talk about the reasons why from a systemic approach, how we can help improve that and shorten that gap, right? And I think that's important, right? Again, I'm yours truly, Dr. Barry Pierre, board certified internist, the host of Medicine Mondays and Lunch Number Dr. Barry podcast. So today, let's talk about it. Let's have the conversation that needs to be had. And hopefully, right, by the end of the video, right, or the audio, depending on whether you listen on the podcast, hopefully by the end of it, right, you have an idea of what I need to do, right, to not fall in that group statistic of dying at least 5 to 6 years on average younger than women, right? And again, it's Men's Health Month, right? So why not talk about it, right? Let's have a conversation. All right, so here is some reality, here's some numbers, here's some facts, here's some things that should be concerning for everyone, right? Not just the men, right, but for everyone, right? Men make up nearly 80% of the deaths related to cardiovascular deaths, especially under the age of 60. And we'll talk about what happens after the age of 60 when we're doing Women's Health Month, right? But under the age of 60, men by a long shot. Suicide 4 times is more common to occur in men than women, right? And by get suicide, right? Now the attempted, right, women lead, but as far as committing and going through and doing what they need to do, men by far. And these are numbers. We talked about this on our prior episode when we kind of gave you guys what checkups you should be getting done, right? 40% of men avoid seeing the doctor unless it's absolutely necessary. And what does that even mean? Right? When you say absolutely necessary, that screams, hey, when the symptoms are so bad, I can't avoid it anymore. And that's the thought process I want us to be divorced from. We should not be waiting until, guess what, the symptoms are so bad that I got to go see a doctor. No. Because remember, we talked about it. Aggression is much easier to do on the prevention side than it is on the treatment side. We can be very aggressive trying to prevent some things. Can't be aggressive in trying to treat, right? Like a lot of times we're pigeonholed to what we can do, right? 40% of y'all are waiting until it's absolutely necessary, meaning that the symptoms are absolutely kicking y'all butt, right, before y'all come to see us, right? Problem at hand. 40% of men are less likely than women to seek preventative care. Sad things. And again, this is what happens when we avoid issues like diabetes, hypertension, high cholesterol, electrolyte issues, cancer-related issues, screening issues. All of these problems just get compounded because, again, we are not going to get what we need to get done when we need to get it done. So when we rewind and say, man, how is it that men are dying younger than women? Boom, boom, boom. That this is where the foundation lies, right? But again, we're here, right, because we want to make sure we don't be part of that statistic. And remember to subscribe to the podcast, right, to keep being here, right, to keep catching these tips, right? Subscribe to the podcast, subscribe to the YouTube channel, hit the notification bells, leave a comment for my podcast listeners, 5-star comment. I want to see some them comments start running up again. So we'll talk about why this avoided, right? So again, and I always go back, right, especially when I think about this conversation, right? Because it is one of those conversations that when you hear it, a lot of it, you just say like, oh, okay, men are more dangerous, men are more adventurous, they're doing some crazy things. I got a son, 2 daughters, right? And my son does things that I'm like, I could scream, right? That my daughters just don't attempt, right? My son will jump off things, climb things, and just dangerous things that you should not be doing. Versus what my daughters are like, again, and I don't know what it is, right? I don't, it just like inherent for them to want to just attempt to do some things, right? And that's my son all the way, right? So I know a lot of us can kind of picture, think about the grown sons, right? These grown adult men who just do things where they be dangerous, and you're just like, what are you doing, right? And I think about that when I hear 40% of y'all are avoiding seeing us in office. I think it's just as dangerous than you going to try to rock climb or jump off a cliff or skydive or whatever things that is considered dangerous. I think it's just as dangerous when you guys avoid seeing us for a decade, right? I think that is just as dangerous as you jumping off a plane with no parachute, right? Like, cause that's what you're doing. You're walking through life without the parachute of having good preventative health care, right? And then you're wondering why, boom, you fall flat, right? And we're not gonna hear, not anymore, right? But I do want to call it out, right? Because again, I think a lot of times when we think about, oh, the men are doing dangerous things, we always think about a dangerous things being something we can kind of look at. It's like, oh yeah, that looks dangerous. Like they're gonna scuba dive 1,000 feet. I don't know what a big number of feet is, right? They're going to jump out of a plane. They're going to do something. We think that's dangerous. And I think it's just as dangerous when you're walking around 3 years, 5 years, 10 years, having gone to see a doctor. I think that is just as dangerous than those other things, but I could be wrong. Put it in the comments if you disagree, right? So again, very important to understand, what do we do about this, right? That's why we're here. What do we need to do? What do we need to change today? Not tomorrow. What do we need to change today after I watch this episode to make sure, right, that I can reduce the gap, right? The goal is, how can I reduce the gap, right? Again, the system at hand, right? And I talk about this all the time. The system at hand is maximized to get you in and out. And I know for men that may think that, like, all right, they're just wasting my time if they're just trying to get me in and out. So if they're going to waste my time, I don't want my time wasted. I'm going to avoid them, right? Like, no. Like that's no. We're not going to do that, right? The system at hand, right? The healthcare system is, it's a well-trained machine to get you in and out, see you in 13 to 15 minutes, get your diagnosis, get your treatment done, like it works the way it works. And as a patient, you just have to take advantage of what you need to take advantage, right? So these are the one things, right? The 5-minute check-in, right? I like this step, right? One thing I like to do, right, especially for my men who may not see the doctor often, I always say, hey, I just need you to do this thing once a month for about 5 minutes. Know what your blood pressure is, right? Know what your weight is, and know how you're feeling, right? And I want you to think about that, right? Like, know what your blood pressure is, know how your weight, right? And know what you're feeling, right? When I say feeling, right, this is when you're anxious, stressed, depressed, happy, all of the above, right? Like, be able to just document that. Like, have a nice little journal, right? To understand, like, all right, yep, my blood pressure is pretty stable. Yep, my mood is pretty stable. My weight's kind of getting up there. Let me take care of the weight, right? Oh, my blood pressure is kind of climbing. My mood's okay. I'm feeling good. Oh, all right, let me make sure to follow up with the blood pressure. Like, oh my God, every time I follow up, I'm feeling depressed. I'm feeling anxious. All right, so you kind of understand what things you need to kind of have a handle of before you even go into the doctor's office. Right? Because those are 3 big, like, encompassing things that if you just understand those 3 things, right, you're going to be halfway through the battle, right? So understanding my mood, my blood pressure, my weight, your BMI, yeah. And obviously when we talk about weight, that's your dietary habits. These are things, again, this is kind of all encompassing. But if you just understand, if we just zoom out, because a lot of times we try to hit a home run when it comes to our health right on the first swing. And a lot of times we just need consistent singles. For my baseball folks, we just need consistent singles just to get around bases. A lot of times y'all are trying to get a home run and then get up out of there. In health, it don't work like that. Just being honest, it just don't work like that in healthcare, right? Number 2, and I like this, right? Find a health wingman. Y'all hear me say this all the time. A lot of the reason why y'all come to the doctor, right? And I keep saying y'all because I'm talking to the men this month. A lot of the reason y'all come to the doctor is because someone out there is either pushing you to come to the doctor, or you're like, hey, you know what? sexually something's not happening, I need to go, right? A lot of y'all, not 100%, not 100%, because I don't want y'all to 100% me, right? But a lot of y'all are needing an extra push to come to the doctor. Whatever the extra push is, we appreciate the push. Now bring you behind on the offer. So again, you cannot do this alone, right? So again, ask a buddy, a partner, barber, someone like needs to know what your health is looking like, how your health is proceeding, and how to get you to the next level, right? Someone's got to be there, right? So find you a wingman, right? That's number 2. And number 3, the ask to rule for your appointments, right? You should go into your appointment knowing you got 2 questions to ask. I don't want to hear you got no questions when the doctor is done talking to you. No. Walk in there with like, I'm going to ask these 2 questions, whether it be like, hey, what is this risk factor that I should not be ignoring at my age, right? And I may get back into that those age-related screenings. Is there a lifestyle change that I can employ right now? Right? Those, if you need 2 questions, take those 2 questions. But you should go into your appointment ready to ask something, ready to be educated on something. Because I can assure you, your doctor wants to provide answers. They just don't think you're looking for them. And a lot of times your doctor be like, any questions? Any concerns? Like y'all hear that all the time. And so many patients be like, no, that's fine. Everything's good. Even though they have questions on like, all right, they said something about a medication. I didn't really know, but I'll worry about it later. No, ask the question now, right when you're in their face, right? Like, because your doctor wants you to get to where you need to get to, right? Again, that's the big thing for me, right? And we can go back to a prior episode when we talk about all of those age-related screenings. That's important. Like, that's important. That's already said and done. But I think if you get these 3 aspects here, as far as 1, right, doing your self check-in, right, checking in on yourself, whether it be your blood pressure, it be your diet, whether it be your mood, like that self-checking you do on a month-to-month basis. Number 2, whether you implore your wingman, whether your wingman's a family member, a friend, somebody who is your accountability partner in your health. You need it to stop playing games. Yes, you need it. And number 3, right, the ask 2 question for every appointment, right? Ask 2 questions. Gotta have your 2 questions. If we start doing these things as a collective, they can't stop us, right? Like we'll close that gap, right? Like we will close the gap of dying early if we actually make it a proactive approach, right, to trying to live. Because that's really, at the end of the day, we are not having a proactive approach in trying to live longer, which is why we're dying longer. Women are accustomed to seeing a doctor, getting regular checkups since they were young, right? Since they got their period, accustomed to doing it. Men, nope. Like we just kind of float through life, go through puberty, floating through life, get to adulthood, trying to float through life, right? And that is why we don't know what our blood pressure looks like. We don't even know how to talk about our mood. We don't even know how to talk about when we're stressed, when we're angry, and we're anxious. We don't even know how to talk about these things because we're just walking around through life like everything is cool, and everything is not cool. And we know everything is not cool because y'all keep us, and I say y'all, I'm included, we keep dying earlier. So clearly everything is not cool. Whatever lie that you've been fed to tell yourself that everything is cool is a lie because the numbers don't lie. Right? The number is saying that we are dying earlier. We keep dying earlier. We keep getting more suicides, more cardiac deaths. The numbers do not lie. Right? And it just goes back to us we want to be aggressive in every sense of the word until it comes to talk about being aggressive with our healthcare. That doesn't make any sense, does it? We want to be aggressive in every sense of the way until it comes to being aggressive with our healthcare. Be aggressive with your healthcare, right? Like that's, if you don't get nothing else from today's episode, be aggressive with your healthcare, right? So again, that's the recap for today, y'all. That's the recap for today, right? We want to live longer. The goal is living longer, healthier too. Because that's the problem. Because I don't say the problem, but the thing with medicine, we can keep you around for a long time. You may be in diapers. You may not be able to move the left side of your body. You may be on dialysis, but we can keep you around for a long time. How do you want to live when you're around this long time is really the question. And if you're aggressive the way you need to be aggressive, then when you get to 40, 50, 60, 70 years old, you're one of these spring chickens out here, versus one of these old decrepit people who just kind of sit in the bed and just kind of wait until their time has come. I'm yours truly, Dr. Barry Pierre. Y'all have a great evening and stay blessed.